but it's
Mm.
very easy to scale. And that's our goal is to say, how do we make primary care more accessible, relationship based, and incentivized on healthy outcomes and almost disrupting the sickness funnel that exists in some of these traditional healthcare settings.
Mm. So we're here today with Nathan Barr, and Nathan is the founder and CEO of HealthBar, which is a
Hmm.
Grand Rapids-based healthcare service. How you doing, Nathan?
I'm doing great. How are you doing?
I'm doing okay.
Yeah.
We had a little snafu I was talking about beforehand, but hopefully everything will be fine. So Nathan, tell me about HealthBar in a nutshell. What do you guys do?
We do really a hybrid model of primary and preventative care services where we deploy on-site clinical support to businesses, schools, and communities, supplemented by virtual health support. Really, with the idea of how do we reimagine how healthcare is delivered, really from that urgent care and below scope. So we're not talking about complex emergency care or surgeries or things like that, but how do we deploy clinical services that prevent disease, that reduce chronic disease exacerbation, and really tries to get upstream on a lot of the problems that we're seeing within our healthcare industry. So our model is unique in several ways and how it's delivered. We are I would say, cash-based healthcare service, so we don't bill insurance for what we do. So that would be a difference and a unique. Um, and then we've created incentive models surrounding healthy outcomes versus sickness-based outcomes. So
Mm.
yeah, it's been very fruitful, rewarding work. We get the privilege to work one-on-one with individuals and change lives every day.
So who do you provide these services to mainly, in your
Yeah, typically we'll contract with a business entity, school district, or another setting. And what we'll do is, let's just say that business has 300 employees. We will then assign a clinical team to those 300 employees plus their spouses and dependents. The business pays us one singular fee per month, and we provide unlimited healthcare services to that population. So it really gets around that whole, we don't make money on doing more services. Our revenue is capped. So I'm a big believer in realigning the payer provider relationship. A lot of our healthcare models benefit off of sickness,
Mm.
more volumes at fee for service models. You do more, you get paid more. We really
Yeah.
wanted to build a model that said, use us as much as you can, but the outcome of using us more should be reduced use of sick care and hospital systems, which is more costly. And so, kind
Mm.
of, rethinking how value-based care
Mm.
can be delivered and delivered at scale, which is also a big differentiator for us.
So you're providing primary care services to people who are associated with some business or other organization.
Or school district. We provide, yeah,
Yeah.
these services to schools, K through 12 schools, as
Mm.
well as some college student populations. So trying to
Mm.
get the whole age range down from your, younger pediatric clients all the way up to your, 60 plus year old getting ready to retire clients.
Okay. I remember back in the day, and not too long ago,
Mm.
we had the school nurse, right?
Yeah. Yep.
And
Yeah.
the kid was sick, they go see the school nurse, and
Yeah.
so you're supplanting that service in some
We're
situation.
we're leveling it up, I would say. I would say what we're doing is taking what that school nurse has done, which has been very tasky, bumps and bruises and medications and some of the basics, and how do we level it up to do health education and empowerment for young kids, yeah, in their developmental stages? So how do you teach them about true nutrition, not just the food
Mm.
pyramid? How do you teach kids that sleep is good and hydration's good and activity's good and things like mindfulness and staying off of social
Mm.
media and all these things that we know are potentially bad for us but are hard to implement. The
Yeah.
nice thing is we have the benefit of time with these individuals, so you can have in-depth conversations and really get to know them from a personal basis.
So you're taking a kind of a holistic approach
Very much,
to these people's health.
very
Okay.
much so. Yes.
So in the case of school district, not to drill down too far on this in the beginning,
Mhm.
but when you're dealing with a school, do you have people actually located at the schools, or do you come in, on a periodic basis, or as a result of something happening?
Yeah, typically, so our model in that decentralization, so hospitals consolidating and kind of bringing a lot of functions underneath one roof. What we've done is said, what if we can do the opposite of that? What if we can take clinical resources and embed them into these physical structures? So we'll typically have clinical teams on site at these locations, a lot of times on
Mm.
a daily basis, available for medical needs as they occur, or being able to, through chance encounters, educate these individuals on healthier lifestyles and behaviors. So it's a very accessible model. And the beauty of it is that there's no charge to it. So
Mm.
these individuals use our services, it's completely free to them. And huge value add. So yeah, we do that, and then we supplement it with a virtual access point. So if you think of virtual, we all are used to virtual, just like this meeting here across the screen.
Yeah. Yeah.
Um, but we enhance that with access to your clinician team via phone, text, email. So the model actually feels like a concierge level medical resource too.
Yeah. Yeah. Well, let's back
Yeah.
up for a minute. I see that you are a registered nurse background.
Mhm.
Uh,
Correct.
my
Yep.
mother and my sister were registered nurses,
All
and
right.
my mother was
Love
the
it.
assistant director of nursing at Hurley Hospital in Flint,
Love
uh,
it.
across the state. But
Yeah.
backing up, how did you get into this?
Yeah, I mean, it was not my intent when I started my career out was not to be an entrepreneur. I kind of find myself into entrepreneurship. You don't know what path, life's going to take you on. And so I knew I had a passion for taking care of people. I knew I loved kind of the health field. I thought I was going to be a doctor when I started. It's typical male stereotype is you get into healthcare and you're going to be a doctor.
Yeah.
But I found that the nursing profession much more aligned with my core values of just care and empathy and wanting to teach and walk alongside of patients during those times and have that impact. And so
Hmm.
went the nursing path, graduated, started working in the emergency department as my kind of first go, and learned a ton. ERs are
Mm.
not for the faint of heart, and they'll test you
Yeah.
in a lot of ways. But love the experience. But found, I was a go-getter, and I like solving problems, and found that I had a knack for leadership, and so I climbed the corporate ladder at a hospital on the south side of Grand Rapids here to University of Michigan Hospital now,
Mm.
and eventually became the director of emergency services, along
Mm.
with other departments, and just got to see the business side of healthcare, which
Mm.
was much different than the clinical side of healthcare.
Hmm.
Again, learned a ton, and my mind kept trying to solve problems. And trying to solve some of the problems that I wanted to solve were system level problems and access level problems that it's kind of like trying to change the course of the Titanic with an oar, right? It's not gonna happen. And
Mm.
so, I thought about starting a business, but I was like, no, I can't leave my team. I had the golden handcuffs on, and then I was come May of 2020, that decision was made for me. I was let go
Mm.
during a round of
Oh, wow.
layoffs, and
Hmm.
so I had an idea, I had a dream, and I was a clinician during the pandemic who could solve a problem. And so I started contracting with businesses and schools, and we were doing COVID support services for them, COVID testing and screenings and all of
Mm.
that, return to work stuff,
Hmm.
and safe operations. But I had this vision for all those problems I was trying to solve. And
Yeah.
we did the early COVID work. I built up, teams and infrastructure. We were doing services, right? So I bootstrapped the business. It was do services, get paid, and then continue to build off of that. And was able to secure some contracts, start building and growing effectively, and started formalizing some of our longer term programs early on in the business. And we're
Mm.
we're 5.5 years into it now, and still surviving, and I would say somewhat thriving.
So it didn't take a lot of capital for you to get started at first. You doing fee for service kind of work with different organizations around
Yeah, it was
COVID
services
testing
based
and that
work.
sort of thing.
Exactly. Yeah. Services based work. I'm always a big believer with businesses. What problem are you solving and how are you adding value? And, bootstrapping and with services, you can, I had a clinical background and competencies and knowledge and skills. And so I could go provide effective services and solve some pretty large problems for these organizations during that time.
Mm.
Taking that and then multiplying it by adding additional team members and selling more contracts was able to grow the organization and create somewhat of a base structure
Mm,
for it. But yeah, bootstrapped it
mm.
through that. And, I think I see two differences. You can be an entrepreneur and you can have a great idea and you can try to force it onto a market, or you can be an entrepreneur and try to provide value and iterate services to mold into a market. And we've been more of that ground up mold into a market model.
Yeah. So, I can imagine though, going from, everybody was uptight about COVID and there was this need for
Mhm.
all these services and whatnot. But then I could imagine that businesses might transition or try to transition back to the way things were before. How were you
Yep.
able to make that transition away from, COVID related services to more general primary care?
We definitely knew that was going to happen. None of us wanted the pandemic to last forever, even if it
Yeah.
was it was our business supports that we were doing, and that's how we were making money at the time. We wanted it to end just like everybody else, and so we knew very early on, and really started doing this work within the first 6 to 10 months of the business. Is how do we start building the programs and the infrastructure for this future vision that I wanted to create? And that's so we did that work kind of in the background
Mm,
while we were still doing some of those COVID services. And by the time that kind of that dropped off, we were able to bring to market our new services. So we reimagined the business, within the first year, year and a
mm,
half of what we were originally doing. But that was the vision of, what I wanted to create. So it was
mm,
being proactive about that and not
mhm.
waiting for that drop
Yeah.
off to happen. And it happened really fast. It was over the
Yeah.
course of a couple months, and it was just over. Um,
Yeah.
so,
Now,
yeah.
when you say we, who was the we?
Yeah, over the course of my career, I've always been a huge believer in don't burn bridges and build good relationships professionally and personally, conduct yourself in a high manner. And so I had built up a lot of clinical relationships over the years with various members of the community. And as I got out into my own business, I was able to reconnect with those business leaders, clinicians to help us, win business, but also to build my clinical team to continue to perform our services. And so
Mhm.
really leveraging that large network that I had taken a, 13-year career up to that point to build, and taking that professional reputation and then, social platforms like LinkedIn, and really creating a brand behind
Mhm.
HealthBar and a purpose and
Mhm.
a mission with all of those. And
Who
so
helped you
brought on, yeah.
strategize? Who helped you strategize all this? Did you have, like a core team of key people?
Yeah, there were individuals that I kind of surrounded myself with that I knew covered my blind spots. I
Mm.
knew healthcare really well, healthcare business and finance and operations and clinical delivery. I knew all that really well, but I'd never run a business before. And so I brought on individuals and surrounded myself with advisors that could cover those blind spots up. So there were a few individuals that I brought on early in the business. I brought on an early business partner named Gary Von Meyer, who helped with the business side of things,
Mm.
and then we started building that infrastructure. And then I brought on chief operating officer or director of operations, director of sales and marketing, and kind of looked at like how do we solidify those
Mhm.
areas of the business, but
Yeah.
always took that lens of what am I not the greatest at, and how do I
Yeah.
support myself through that.
Yeah. So how are you structured today as a business? Are you LLC,
Hmm.
partnership? How are you? What's the structure?
Yeah, we're an LLC structured, and then we file as an S corp from
Yeah.
that side of it. But yeah, an
Yeah.
LLC at S corp structure.
Okay. How do you guys make money?
Yeah. So if you think about how we pay for healthcare right now, you go to a hospital facility or a doctor or whoever else, and the more they do, the more they get paid. And but the idea is there's an incentive almost to document more, to charge for more, to get that CPT code added into there. For us, we looked at it and said, you can do all these things, but for a much, much less amount of money.
Hmm.
And if you do it in more of this capitated payment model where there's almost like a fixed fee, so we get paid a fixed fee every month via the businesses we work with or the school districts or
Per
other
person?
groups. Yeah, it breaks down to a per person style
Mhm.
billing structure. So a
Yeah.
lot of the billing model kind of looks like a direct primary care billing model where it's a
Okay.
per
Yeah.
person per month style thing.
Yeah. Yeah.
And so we have our fixed revenue that we can depend on coming in. And then we align clinical resources and expense to that revenue coming in and assign that coverage to that population. So then we can produce appropriate margins to operate and continue to grow.
Mm,
The beauty of it is that now that population has a healthcare resource that they have unlimited access to. And
yeah.
so our imperative is to provide a lot of healthcare and to reduce utilization of other healthcare services to produce an ROI for those businesses or other entities.
Mm. Roughly how many healthcare professionals do you employ in this operation?
We have a total of 85
Whoa.
employees right now. So yeah, about I would say 10 of us are, I would say, more administrative and leadership oriented. The other 75 are clinical providers who are out there
Mm.
taking care of patients every day across the state of Michigan and now in some other states.
Are they all full-time people with your
Not all,
organization?
not all full time. We have a mix of full time and part time in that 85. So, yep.
Mm. Hmm. What is the what's the package of services that you offer to these organizations?
If you kind of think about what you go to an urgent care for, right? Minor injury, illness, not like emergent stuff, and then
Yeah,
go in severity, everything below that. That's really our scope of service. So we can prescribe, we diagnose, we draw labs, we can do all that kind of stuff. But
yeah,
there's kind of that sick care side where it's like, hey, we're managing disease and we're managing illness. A lot of what we really love doing, though, is taking those opportunities while we're providing that sick care and then
yeah,
educating people on here are some things you can do from a behavior and lifestyle standpoint to, you know, things like sleep. Like people are like, they just pass over sleep, like, oh, I don't need sleep, whatever. But it's one of the most crucial things we talk to people about is sleep hygiene. How do you
mm,
consistently go to bed at the same time and wake up at the same time? How do you prepare yourself for sleep? Your body does so many amazing things while it sleeps.
yeah,
And so just optimizing that. And most people aren't very resistant to being told to sleep more. Most people like that. So,
yeah.
yeah,
I have that problem. I don't like to sleep, so I end up not sleeping as much as I should, and then I'm messed up
yeah,
during the
yeah.
day. So
It does. It totally
yeah,
does. Yes. Yep.
yeah. So thinking about the school model again, going back to that. So
Hmm.
I'm wondering about the relationship between your practitioners and the patients. So I'm in school. I get out of school in June.
Hmm.
I have some, I stumble, I hurt myself in July. Can I still see, are you still contracted with that organization? Can I still see the practitioner that saw me during the school year?
Yeah, so you have your provider. The school year is unique, and it's a good thing to carry out or to bring up. Our clinician schedule kind of follows the same as a teacher's schedule for those school districts, and so our clinicians that are assigned to the districts or populations have the summers off or whatever else. But then we back it up with our general clinical services. So you think of that scenario,
Yeah.
having that student or family reach out to a provider who's covering that group then in place of that provider for the summer. So they still have direct access, still have the services available to them. It might just be a
Mhm.
different person.
Now, what about when somebody has to go into the hospital? Uh,
Hmm.
I'm assuming you all don't. Most of the primary care folks nowadays are not following people into the hospital. I just learned this recently. There's like a hospitalist that
Yes,
you see.
yes.
Is that the case in your situation?
Yeah, we don't have where a provider will go into a hospital, right? A lot of reasons for that, but one of the bigger things is, if we're developing a relationship, let's say you're my patient and I'm taking care of you on a day-to-day basis, and you're just talking to me about, general health needs, or I'm helping you, refill prescriptions or doing an annual physical, and then something occurs and you have to go to the hospital because where there's established rapport and relationship, typically the clinician is notified that one of their patients has been admitted to the hospital or has had a visit. That can happen by a variety of ways. We will then typically reach out to that individual. So I might call you or reach out to a family member or somebody of yours to say, hey, what's going on? Can I help clarify anything that's being said to you in the hospital? Do you have any questions about
Mm,
what's going on? But that's, we typically leave that in the hospital's hands. We can act as an advocate. But post discharge, that's where we get reactivated. And so now you're
mm,
home. You're like, I have no idea what they told me in the hospital.
mm.
I was all out of it for a while and now I'm home and I have no idea what to do. I'm
Yeah.
right back here with you now. And it's like, okay, here's what happened. Here's what we're going to do. Here's the plan. I'm going to help support you through it kind of
Mm,
thing. Yep.
hmm
Hmm.
how many of these patients that you're dealing with have insurance, or some other access to care that along with what you're providing?
Yeah, there's a decent majority would still have insurance with this model. We don't come in and replace a lot of those things. Our whole goal is how do we get you to use your insurance less? So almost
Mm,
looking at your insurance in parallel to like your car insurance or your home insurance is that we don't use those insurance products for preventative maintenance on those
yeah,
things, but we use health insurance for preventative maintenance on our bodies.
yeah.
So why is that? So we act as that service provider for the preventative maintenance and for the primary preventative care side of things. When you have a higher level need, like a hospital stay or an emergency department visit, that's when your insurance can reactivate and be used for that kind of stuff. And so it's the whole idea of using less insurance is good overall because the way we're doing it is much more cost effective.
Mm, okay. So what is the scope of your services? You mentioned that you're based in Grand Rapids, but you mentioned that you're even
Mhm.
operating in other states now. So,
Yeah.
you taking over the world? What's going on?
Our goal is to, we're building it to be scalable. I think that's where a lot of these solutions fall. They fall into being too localized, and local care is fantastic, and that's what we want to reinforce. But we need to have models of care like this that can be deployed in a broad scale. And so we're creating almost a system or a way of doing primary preventative care that integrates into existing infrastructure. So it's very capital light. You're taking a method and a way of providing this clinical care, and then replicating it in another market. And so we're doing this now with a group in Illinois. We're going to be doing it soon with groups in Ohio and Alabama and Pennsylvania shortly after that. But it's
Mm,
very easy to scale. And that's our goal is to say, how do we make primary care more accessible, relationship based, and incentivized on healthy outcomes and almost disrupting the sickness funnel that exists in some of these traditional healthcare settings?
mm. Yeah, well, this access to healthcare is a real issue in urban communities, and it's far from being solved. And you said you were involved in the whole COVID, emergency, and I'm sure you saw how devastating that was to a lot of people in urban communities. So,
Mm-hmm.
looking at this model, what
Yep.
would you say is the real chance to, change the game in urban healthcare using models like this?
Yeah, I think it's immense. If you consider we look at a population of people in a business setting or school setting, but that can be deployed in a community setting where you have a density of individuals in a certain geography. You can embed a clinical resource within that geography, have it home based somewhere. Maybe it's a local office or building that's accessible, but then have that clinical resource deployable to people's homes. And what you're doing is relocalizing that primary care access point. So when you talk about transportation issues or other types of issues that are barriers to healthcare access, cost related issues, trust is a huge one. We can embed a clinical resource in a community setting that's able to come to your home even and
Hmm.
provide you that care. So breaking down a lot of those barriers of cost and access for those communities. For
Yeah.
us, and what we're working on doing is centralizing a payer source, and so we can provide that service free of charge to those individuals. And that's how we're able to do it via those businesses and school settings as a central
Mm-hmm.
payer. And then
Yeah.
we can cover the rest for free.
Yeah. Well, it sounds
Mm.
like we're kind of getting back to the way things used to be. I know growing up in
Yeah.
Flint was
Yeah.
a pioneer of something called a community schools model.
Hmm.
And people in that community got a whole range of services, that came from the school. It was something that was pioneered in Flint by the Mott Foundation.
Yeah.
And that was a model that, kind of spread pretty wide, but then it went
Mhm.
away, right? And we went into this kind of
Yep.
impersonal system that we have now.
Yeah, a lot of people ask us, they're like, it's so innovative what you're doing. And we're like, honestly, we're just going backwards to the way it was and the way it should be.
Yeah.
But we're creating a business model that can exist in that ecosystem where a lot of the healthcare models have been scooped up by, private equity or venture capital or become these money-making machines that
Yeah.
has not benefited these types of models.
Yeah. Yeah, it's crazy,
Hmm.
I'm sure you could tell a lot of stories, and I just experienced some stories because I had a
Hmm.
little scare a few weeks ago. It turned out to be nothing, but I spent 36 hours in the hospital, and there's a whole system where this person has to see you, and then this person has to see, and you just see the cash register going right because now everybody is
Yeah.
enabled. They can see you, so now they're going to see you.
Yeah.
Everything, I think I
Yeah.
had everything but a psych evaluation. Maybe I had that and didn't
Yeah.
know about it. But
You
yeah,
probably did.
it's quite a racket,
Yeah.
the
A lot
system.
of it, when you get out of the insurance, a lot of what the insurance system does is that it protocolizes and creates steps to get to certain reimbursement levels. And so if you're, near the hospital and they're like, hey, to get discharged at this level of care, you need to have all these evaluations done. They bake them into quality metrics and, all these things in the EMR. But you're jumping through all these hoops to enable an insurance bill to be billed. Now, there's clinical efficacy in these interventions. Some of them have to be done, but we get asked a lot of times too. It's like, hey, you are you're receiving this care, but why, if you ordered the CT, why couldn't you just go to the MRI if you needed the MRI, right?
Yeah,
But what
yeah,
happens is that you need to have the CT done before they'll authorize the MRI from a
yeah,
payer standpoint. And
yeah,
that's the bigger problem is that a lot of these things are protocolized and they have to happen, but they're super inefficient.
yeah. Wow.
Hmm.
So thinking about going back to the day, do if I'm a patient of your operation, your service, will I have access to the same practitioner, year after year? Will I build a relationship with people, or are these people constantly moving around?
No, the idea is to have a consistent provider who's there getting to know you, building longevity in that relationship and that trust at the end of the day. We find that a lot of core health issues people want help with, but they don't have time to discuss it with
Hmm.
their provider, or they don't have the trust there to
Yeah,
discuss it with their provider, or it's just a different person every time and they have to repeat themselves constantly, right? So
yeah,
if you
yeah,
get to know that person, you can really start digging into some of those deeper health issues and needs that can solve core problems.
yeah. So Nathan, you seem like a very, competent, very, capable person. And it seems like you got everything handled. But I know in business,
Yeah, yeah.
sometimes we run into obstacles and, we're sweating in the middle of the night and this kind of thing. Have you had situations like that? And what's been the most,
Mm.
terrifying situation you've encountered so far with this business?
Yeah, the outside looks very shiny when
Yeah.
you're looking at it. It
Yeah, you
looks
project
linear, like a
well.
perfect line. It's like, hey, you know what? Things are great.
Yeah.
Yeah, no, it's entrepreneurship and business ownership is a seesaw with more ups and downs than I have ever experienced in my life. 100% has been some of the biggest challenges. There's early in the business, we jumped out of the gate. We responded big to COVID. There was a lot of need there, so we
Mm,
were fairly successful very quickly. But over the transition of us switching from that to our core business model and developing these programs, we went through a lot of pain where I would say kind of went into true startup mode then, where we had built up a little cash from early services, burned through all that. I had to take out a second mortgage on my house and liquidate my
mm,
retirement and pour that all back into the business. And I was super leveraged. And there was a couple years there that where it took a very heavy toll on myself. And it was I clung to hope. I knew what we were doing was good work, and we were getting really good validation from our early clients. And
yeah.
and I just had this belief that it was gonna work,
Mm,
and I just kept grinding every day.
yeah.
There's certain business things you can do to extend cash flow and do whatever else, but I was scared to answer my phone sometimes because I was so late on payments for things, and people were calling me to say you need to pay me kind of stuff, and I was
Yeah.
afraid to answer my phone, and it was just not a fun period of time. And
Yeah.
luckily we've come out of that, learned a ton of lessons, but realized that it could have gone the opposite way, and I might have been sitting
Yeah.
at that transition point, and it could have failed, and I would not
Yeah.
be here today. So
Yeah.
yeah.
It's kind of my pet peeve, when people see people who have succeeded in some business and they don't delve into, there's almost always, I don't know of a situation where somebody didn't have it tough, at some point
Hmm.
in building a
Yep,
business, because there's so many forces out there that are trying to hold you back, right?
that's
And
right.
so, yeah, I appreciate you sharing that with me. There was a point, I have to tell you a quick story, when I was
Yep.
starting my business. Um, and I was going on a business trip from New Jersey up to Boston, and my daughter had just been born. And
Mm.
so my sales manager came to pick me up. We were going to see a client, and I'm walking out the house to get in the car, and my wife is holding the baby, and the baby is screaming, and she screams
Mm.
at me, "Get a job!" So, that was the
Yeah,
opposite of the pretty end of things, right? The
yeah,
cool end of things.
yeah.
Uh, so as
Oh,
I
I
say,
know. Yeah,
yeah.
the temptation was
So
definitely there. Yeah.
yeah.
Hmm.
So
Hmm.
there are people out there in the healthcare space. There's, the traditional providers and whatnot. Who do you see as your main competition when you're going into these businesses to try
Hmm.
to, get their buy-in to what you're doing? What are you up against?
Yeah, there are a lot of solutions that do pieces and parts of what we do. Bigger national solutions, maybe more localized solutions, a little more niche though. And we found that the way we bring our services together and the system that we deploy and its comprehensive nature has hit a sweet spot in that care delivery model that really makes a big impact. And so we haven't found many players who are doing similar entirety of scope that we're doing and the program that we're doing. There are pieces of it that are 100% being done by
Hmm.
many, many competitors. So, I do get asked that a lot, like, who are you worried about? And honestly, I look at it a little bit differently. I look at it more as we all are trying to fix this healthcare cost and access issue, and HealthBar is not going to solve it. No one business is going to solve it. So how do we see ourselves as working alongside of each other to an extent and winning together as I win a new business, as another, organization contracts with a new, population. Those are all to be celebrated, right? And could we have
Yeah,
gotten that business? Sure, but I just think it's going to take so much healthcare innovation and entrepreneurship and work
yeah,
to solve some of our problems that, I hope there are a lot more that come, and I would see them as, not necessarily as competition, but as
yeah,
collaborators in the work that we're
yeah.
doing.
Well, it sounds like you're doing the right thing in that you're focused on the customer and what the needs of the
Mhm.
customer are. You're not copying what somebody else is doing because you see that they're successful, right?
Correct. Yep.
And I
Exactly
think
right.
that is a way to build long-term
Mhm.
success. Um, so yeah, so our friend Ben has compiled like a lightning round
Yeah.
set of questions for us. I appreciate him doing that. And we're gonna go through the lightning round right now, if you don't mind.
Sounds good. Not at all.
Okay. So one misconception about solving healthcare access.
Mm, I think that's bigger is better.
Okay. That's good. That's quick. We're gonna get through this
Mhm.
quick.
There you
One
go.
partnership that had unexpected impact.
Uh, I would say our relationships with the insurance agencies that we work with, they refer our business
Hmm.
to clients that we want to work with and have been a huge unlock
Oh,
for our
wow.
model. And
You
so,
would think they would be on the opposite side of things.
yeah,
Yeah.
yeah, they've embraced our solution and has helped promote it quite a bit.
Yeah. What's one metric that you track that you think outsiders might overlook?
Mm, engagement. For
Hmm.
us, the level of engagement we have with the population is our number one metric of success. Our whole thing is if we're not working with someone, we're not changing their life or impacting their health. And so we want to engage with 100% of the people that we're covering, and we want to engage with them on a regular frequency, so we can maintain that relationship and continue to make impacts. And so we track as our number one metric. And then there's others too, but engagement with a population is number one.
Okay. And last one, as a business leader, what's one practice that you rely on?
Mm. We call them clarity breaks. We use a system called EOS, the Entrepreneurial Operating System. And I take time each week, and sometimes more frequently than other times to spend time in thought.
Mm,
And so, how do I just clear my head, not engage with technology or be thinking about something specific, but just let my mind wander and let it find things,
yeah.
and try to get clarity on some stuff. And so, for me, clarity breaks is key.
Okay. That's good. Well, those are some
Yeah,
great nuggets of wisdom there. And again, I thank Ben Reynolds for compiling those for us.
yeah,
So finishing up here. I'm surprised. I teach a course in entrepreneurship at University of Michigan, and I'm actually
mm,
surprised at the number of healthcare students, nursing students, who
mhm,
are interested in entrepreneurship and who are participating in the entrepreneurship minor degree at
mm,
University of Michigan. And it sounds like you, in starting your business, almost went a traditional path. You were working in the industry, you saw the
mhm,
needs that were out there, you gained expertise. It's not like you came out of school, he said, I'm going to start a business, right? You got in
no,
and you got familiar with an industry and you found what was
mhm,
needed. But what
mhm,
is in terms of thinking about these kinds of people who are engaged in entrepreneurship education and healthcare,
yep.
what's the first practical step that you recommend that they take before
Mhm.
trying to build something at scale?
Yeah, you have to understand what problem you're solving and the value you're providing as a business, and the voice of your customer. Like, who are you actually selling to, and who's going to buy your thing or your service? So doing a ton of early, whether maybe you got early traction with a few clients, and then just following up and communicating with those clients. Why do they love what you're doing? How are you adding value? And then taking that and trying to multiply it from a sales standpoint. Yeah, I think too much. There are some fantastic ideas out there. People will come up with amazing solutions, whether it's technology based or services based or something else, but then the market isn't ready for it or doesn't want it. It's really interesting. I had someone who came to me early in the business and they said, we tried doing this 15 years ago and it just didn't stick.
Hmm.
And I was like, okay, thank you. What did you learn? Kind of, and learn some stuff from them, but also realizing that timing can be everything as well. And so if the market's
Yeah.
not ready for your great idea, um, it may not work. And so, are you entering the market with the right market forces behind you and the right need behind you to be successful and scale? So I think a lot of entrepreneurs will bring something to market and it's a fantastic idea, but
Hmm.
it just doesn't work because people aren't ready for it.
Yeah.
So
Yeah.
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 Mhm.
So one last question. Uh, is there a particular mindset or a philosophy or a mantra that guides you as you go about your work?
I really love the 1% better every day. There's a book called Atomic Habits.
Hmm.
That's one of my favorite books, and it talks about a lot of behaviors and lifestyle practices that you can do, mental states to get into. But the idea is, how do I just get a little bit better every day? I'm not going to boil the ocean all at one time. I can't solve healthcare in a day, but can I
Yeah.
make incremental progress that gets me closer to the
Yeah.
goal every day? And that then generates motivation and generates positive momentum. And it has been huge for me. And so there are days where maybe it feels like, 0.5% better, and there are days where it feels like 5% better, right? But
Yeah.
that average of 1% better every day is really what I strive for and the mentality I try to keep. Just having hope and being positive.
Yeah.
It's
Yeah.
just there's so much crap out there, and it's like, you know what? I'm just gonna do the
Just
right
stay
thing,
focused.
to stay focused, stay positive,
Yeah.
um, and just keep going.
Yeah.
It's just like don't stop.
Yeah.
Hmm.
So atomic habits.
Yes,
That's
atomic habits.
I haven't encountered. So we're actually at Urban Entrepreneurship Initiative, we're building a knowledge base,
Mm,
curating a knowledge base that, we're going to
yep,
have on the site for us. So I'm going to, put a
yeah,
pin in that and think about including that in there. And if you have any
yep,
others for us, feel free
yeah.
to share.
Yeah,
Yeah.
there one other I would say for me has been huge with the business and just structuring it and getting it ready to grow and scale has been the EOS system, the entrepreneurial operating system.
Mm,
So there's a
yeah.
good book called Traction or What the Heck is EOS? Um,
Mm,
and you don't have to be EOS pure, like do 100% of what it sets to do, but
Yeah.
we do about 75% of it, and it has
Yeah.
provided amazing structure and accountability and processes to really help us thrive.
Yeah.
Yeah.
Well, it really sounds like you're having impact in the community. You're doing important work. You're positively impacting people's lives, and you're making money doing it. So
Mhm.
it must be pretty satisfying.
Yeah, I'm definitely at a point where it feels like there's that alignment with mission and purpose, and core values and skill sets, and in a business model. And yeah, it truly feels like a privilege to be able to do the work that we're doing, and to have it be self-sustaining, which is, I think, something that I'm even more proud of, is that we're building something that isn't dependent on the typical insurance systems. Nobody can kind of really tell us what to do or how to do it, because we're being paid by our clients and they're the
Yeah.
ones validating the value of our business. So,
Yeah. Well, that's
mhm.
great. Well, I really appreciate you taking the time today. And I think that our associate Anshika introduced
Yes,
us, and I really
she did.
appreciate her going out there and making the contact and pulling us together.
Yep.
So thank you so much. I'm going to try to get you involved with my class and talk to some of the
Yes.
students there and, really
Yes.
appreciate it. Thank you so
I'd love
much.
to. Thank you.
All right, Nathan. Take care.
Thanks. You too.
Bye bye.
Bye.